being one of them. So women's health expert Dr. Jessica Shepard is here with some tips.
Good morning. Here with some tips. How are you?
I'm doing well. Thank you so much for coming in.
No problem.
And there are, a couple things that you're saying, okay, ladies, we've got to really start focusing on.
Have to pay attention to. I really think that as women, we get so busy taking care of our families, our spouse, our jobs, and ourselves that we always kind of put ourselves at the bottom of the list. But there are certain things that we actually need to really pay attention to. And this being Black History Month as well as American Heart Month, one of the things that really hits both of those spectrums is heart disease.
Sure.
Heart disease is the #1 killer for women. And I don't think a lot of women know that.
You're correct.
You know, there's a lot of emphasis on breast cancer, which is also very important, but heart disease is the #1 killer for women. So
what do we need to be doing? Do we need to be visiting our doctor more often, or getting certain tests, or?
That's the key thing. So making sure that you have, one, a doctor that you can dialogue with, that you're very comfortable with, and making sure that you do routine annual checkups. The other thing that you want to pay attention to is your diet. What's in your diet? So what I like to say is shun the salt. So try and taking a lot of salt out of that, because that's a very big factor in heart disease. And one of the other things too is that we need to make sure that we're visiting our doctor before we hit that time in our life, also known as menopause. Because at menopause we have a decrease in estrogen, which can increase your risk for coronary artery disease, hypertension. So that's when you start to see a lot of those factors come into heart disease. So you want to do something before you get to that, before it just kind of hits you really hard. And family history is the last one. What did my family have that I might be predisposed to? Hypertension, stroke, and coronary artery disease.
And something else, you had mentioned, congratulations, by the way, on the baby, which is coming very soon.
Very soon.
Fertility after the age of 35, which can be kind of scary for women to hear about. It's like, you hear that and you get around that age, you think, I don't want to hear about it.
And then that's what we don't want them to do. So we want them to have the dialogue before the age of 35, because, and the reason is, as women, we're born with the amount of eggs that we're ever going to be born with. So as we start to deplete that reserve, you really want to get to a point where you know what your options are. So at 35, you're like, okay, this is what I'm going to be able to do after this age. And so you want to be able to know, what can I do after and what can I do before? So 35 is that age that you really need to be careful about, because percentage-wise, getting pregnant in your 20s is about 20% a month. After 40, it's 5%.
Oh, wow.
So you need to know some of those numbers before you get to those ages.
So when you talk about decisions, are you talking about decisions regarding adoption or freezing eggs?
All of those.
Okay.
All of those should be in the dialogue before you get to those ages, so you know, do I want to freeze my eggs before 35? Do I want to consider adoption? Do I even really want to wait until after 35 or 40 to start this fertility process? So it doesn't mean it can't be done, or that the chances of getting pregnant after 35 and 40 are none, but you really need to discuss some of those options before.
Oh, those are the things we hate to talk about. Well, thank you so much for the insight.
You're so welcome.
Just a reminder, everybody, always consult a physician for any health concerns. And Dr. Jessica Shepard, thank you.
You're so welcome.